the recording, so
Yeah. Okay. Yes. So now I'm going to give you a small presentation. So we will just understand what exactly the entire 5 day session is going to be like, and also about the condition that we are going to like the asthma. We will try and understand more about it. Okay. So I'm just opening my slides. I hope everybody can see the slides. A small thumbs up would help. You can see. Renuji, can you see the slides? Yeah. Okay. So, in the course of the presentation, if you have any doubts, you can note it down. And at the end, we will have take some time to answer the questions. If I am able to answer, I will answer it today. If not, I will refer with the literature and get back to you. Okay. And it would be good if you all can on your cameras so that it's just not the names that I read. If I can have a face-to-face connection as well. Thank you so much. Okay. So, as you see, our today's topic is asthma. So, in today's presentation, we will understand about the condition, the symptoms, the diagnosis, pathophysiology, what are the causes, what are triggers, risk factors, about the treatment, and what are types of asthma. Okay. So, so we just did a prayer. Now I'll just brief you a little bit about prayer, why we do prayer before the session, and even at the end we will be doing a small prayer. So basically, prayer helps us to connect our inner selves with the divine self. It calms our mind. It prepares our mind, body, and soul for upcoming yoga practices. Not only yoga practices, whatever we do, it just prepares our mind towards what our next activity is. It promotes overall well-being and positivity, makes us feel less reactive to negativity, and it's a realization that there is always a divine force in whatever small or big that we do. So now coming to our topic. So this is a fact that we breathe using our airways and lungs. And our airways always start at our nose point, and then we take in air. It gets into two sides of the lungs, and then there is an exchange of oxygen and carbon dioxide, and we again breathe out through our nose. So this is a small picture. It's a very simple one. So you see here we have a nasal cavity, we have mouth as well, but we are supposed to breathe only through our nose 99.99% of the times. And then we have the pharynx, larynx, and trachea there. So trachea is the windpipe. So this is the windpipe. Here it bifurcates into two. Okay, and if you see there are small branches, many branches you will see. So the air enters through trachea into this bronchi, which is divided here, and then the bronchi, this one, the next picture, if you see, it divides into smaller branches. Okay, those are called bronchioles, and each bronchiole ends up in a alveolar sac. Okay, these are again some tissues. This is exactly where exchange of oxygen and carbon dioxide takes place. So if you see here, there are small capillaries where the exchange of oxygen and carbon dioxide takes place, and then again it comes through our nose as carbon dioxide. So now, what is asthma? Asthma is a chronic lung disease affecting people of all ages. You can get asthma at any age. There is no specific age that you must be having it from childhood. You can get asthma at any age of the time, any age. And it causes inflammation and tightening of the muscles around the airways. making it difficult to breathe. So what happens when the airways become narrower and the inside of the airway lining becomes swollen and inflamed? What happens that there is very little space left for the air to travel. So, from nose to reaching the lungs, the amount of air that usually should enter, it becomes much lesser in case of asthma. And that is when you start feeling breathless, you feel you're not getting enough air for breathing. So here one example is given, like imagine a hose pipe through which you're watering the plant or whatever. If there is a choking in that air, in that pipe, there's a lot of dust collected. What happens? Flow of the water becomes less. So it is similar to that. Imagine breathing through straw. So if your nose is closed, or if the nasal cavity is as narrow as a straw, how much air can you breathe in? So that is a condition. That is what happens when you get an asthmatic attack. Now there are various types. That is just the gist of what exactly happens in during asthma. Okay. Now what are the types of asthma? There are two types basically. One is the intermittent type. The other is persistent. Intermittent is like as the name suggests, it is intermittent. It is not continuous. It comes, it goes, and in between two attacks of asthma, you feel completely normal. What is persistent? Persistent means it is there most of the time. Sometimes the symptoms will be very mild and you will not even feel that you have an attack going on. That it can be moderate or it can be severe. Now, people who have this persistent asthma, they don't even realize that that is not the way to breathe. For them, that is a natural breathing. But because it is very mild and it is very difficult for them to, understand, discriminate between the actual breathing and this mild attack breathing. So they become so used to it actually. So what happens now? The healthcare providers can, segregate the severity based upon what is the how often we get the symptoms and how well we are able to manage during that time of attack. Now, what causes asthma? So, it is very difficult to say what exactly causes asthma. There are various reasons for it. Like it can be genetic, like if your mother had or your grandmother had, if it is done in the family, then one can get the chances of getting asthma is more likely that you will or one person can get. So it is first reason is genetic. It can be genetic. Other is you become very reactive towards allergens like pollens, and you start developing the symptoms of asthma. Next is the air pollution. Now, if you see, air pollution is everywhere. We have, a lot of cities in India which are like too much air polluted. It is so difficult to even, breathe. I don't know if there are people from Delhi here, but when you land in Delhi, you can feel the difference. You really feel very, you can feel that there is a lot of pollutants in the air. So it can be now air pollution, lot of causes. We are all familiar with, traffic and, factory that give harmful, gases out. So all this can lead to development of asthmatic condition. There's one more reason, which is like premature babies. So when they are born and they are not able to breathe normally, what happens? They are given external ventilators. So when they are on external ventilator support, sometimes there can be scarring in that, in the tracheal region. So later in their lives, they can develop asthma or any other respiratory problems. So these are some of the things that can cause asthma. Now let's move to the symptoms. So if you see symptoms, if you have anybody in the family who's suffering from asthma, or if you've seen, the normal one is like, there'll be difficulty in breathing, there'll be cough, there'll be wheezing. And what happens is they find it very difficult to expel the carbon dioxide completely. Now, what happens if we don't expel carbon dioxide completely out? It gets accumulated in the blood, leads to acidosis in the blood. So, blood becomes more acidic, and that can create even several other issues. So, that is why in yoga we say, your expiration should be longer than your inspiration. So, always remember that even when we are breathing normally, you inhale and then make a conscious effort to expel the carbon dioxide completely out. Now, the other symptoms are like tightness of chest, discomfort in the chest. Then this attack can, even long for several hours if not treated properly. Now, coming to diagnosis. Diagnosis basically they take patient history, like they even take, if you go and ask talk to the doctor, they will ask you, does anybody have asthma in the family? So that is the patient history. Plus, what has happened in the last few years or few months, how often you get it. So they will assess based upon that. If you've got a wheezing issue every month, then they will categorize you as a risky, like you may be asthmatic. They say like that, you may be asthmatic, and they observe you for further few more months, or year or so, to actually tell that this person has asthma. The other one is complete blood count. So there are several factors in the blood, when we do complete blood counts. So based upon the values, they can tell. Then there is lung function test. There is spirometry. So spirometry is like, you will have three tube-like things in which balls will be there. So based upon how many balls you are able to, push up with that expiration, with that they can make out. Physical exam is there, and sometimes even chest X-ray can help diagnose. Coming to treatment, there'll be quick relief medications are there for acute attacks. There are long-term preventers, mostly steroids, that are given for long-term treatment. And there are plus the doctors will also educate the patient on how to avoid the triggers. Like there are factors that affect, development of asthma. Sudden attacks and all come due to certain factors. So doctors kind of educate the patients on what they should avoid during an asthma, or even to avoid it from happening, from attack. Now, what can make, these are some risk factors, okay? So, what can make asthma symptoms worse? There are a lot of things that can make asthma symptoms worse. And the thing that affects one person may not be the same thing that affects other person. So, based upon from person to person, the triggering factors may be different. So, what sets of asthma? What sets of one person's asthma is called as a trigger. So we should always be watchful about the triggers. Like if somebody is getting an asthma due to one particular thing, then they have to be vigilant about it. And it may not be just one trigger. They can be combination of multiple triggers as well. So we always have to be watchful, and we have to see what is affecting us more. Now, coming to triggers that we were talking about. So there are so many triggers. You see the list is long, and this is not just it. There'll be many more others that can, create or give you a sudden attack of asthma. Tobacco smoke, okay. You may not be smoking, somebody else is smoking, and then you can just get it. Perfume sprays, then if you have cold, cough, pneumonia, any sort of such infections that affect the respiratory part. Then allergens in food, that is also very important. Sometimes when we do vigorous exercise, one may get an attack. Air pollution and toxins we've already spoken about. Weather changes. Sometimes the weather, especially in Bangalore where I'm living, they switch of weather. Like one day it is sunny and the other day there is no sun at all. It's very cold these days. And sometimes, what happens in coming few days, there'll be rain and sunny days. coming very quick succession. In this kind of weather, especially in Bangalore, these respiratory illnesses are pretty much high. Now, coming to drugs, certain drugs, if some people take certain kind of drugs, it can even cause an asthma attack. Food additives, MSGs, monosodium glutamate. So the moment a patient goes to the doctor, when they inquire about food, they tell them not to eat any food item that has MSG. So it is a triggering factor. Now, emotional stress and anxiety. So, this is also a very important factor in these kind of patients. Then, acid reflexes, then occupational irritants. Sometimes some people work in such environment where there is a lot of gas, fumes, dust, etc. So, that is one of also the trigger factor. Then microscopic droppings of cockroaches, pollens and molds, plants, plant proteins are there, certain enzymes in that plant protein, pet danders. Okay, all these are also trigger factors. Now, I don't know how many of you know that cockroaches, especially in chocolate factories. Now, cockroaches cannot get away from, coca. The smell attracts the cockroaches. So what happens in chocolate making factories? In fact, because I've been a part of clinical research for many years, FDA guidelines are there which allow certain parts of these cockroaches in the chocolates. And how many of us know that when we are eating chocolate, we are actually eating little by little, parts of cockroaches, and we are consuming them. So cockroaches are one of the very, very, I would say, important triggers. So in the household, if there is a patient with asthma, you need to first check if there are cockroaches, get rid of them. Stop eating chocolates or, giving kids especially all these chocolates because this has cockroach particles and other bug particles, which is allowed in some quantity by the FDA itself. So you need to be careful about it. Now, coming to pathophysiology. Now, what happens exactly when you come in contact with an allergen? So, what happens is one is it's a complex condition, complex chain reaction that happens when we come in contact with an allergen. Okay, so it's an severity, natural history, comorbidities, and treatment response and all will be different. So a few things can happen when we come in contact with a trigger. Bronchospasm. So muscles around these. So I'll be showing in the coming slides in the picture how exactly the asthmatic bronchiole looks like. So the muscles around the airway constrict, they become tight, okay, and it makes airways narrow. So air cannot flow freely through those constricted airways. Next is inflammation. So the lining of the airway becomes swollen and it does not allow much air to come in and out of your lungs. Then there is mucus production. So when there is an attack, body creates more mucus as a response to allergy. This thick mucus also clogs the air. Now there will be also signs of allergic rhinitis in the absence of if it is not an acute episode, then there are chances of allergic rhinitis. Now what is allergic rhinitis? It is basically itchiness in the nose, sneezing, and if you have noticed when sometimes kids or even adults get cold, sometimes only a transparent fluid comes from the nose, so that is because of allergic rhinitis. So inflammation is there in the nose, but it is not a thick mucus that comes out initially. It is just the watery. Your eyes start watering when there is sneezing and itching is there. All that is allergic rhinitis. So this is the picture. You see here the purple box. There is a space here. So this is the normal lung. Normal bronchiole without any asthma attack. So see it is fully open. The gap from where the air flows, that is more. you know, that lumen is little bigger. So muscles are relaxed, normal airways, and normal amount of mucus also. Okay, but if you see the right side picture, do you see these rings here inflamed? That is inflammation. Okay, and what happens? The muscles around it, it becomes swollen, it becomes constricted, and then if you see inside the lumen, more mucus production is there. All these things, these are the glands that produce more mucus during an asthma attack, and it clogs the airway. So muscles tighten, airways swell, mucus clogs the airway, and lungs have more difficulty in moving air in and out. This is another picture here. This is how the normal airway will look like for a normal person. Asthmatic airway is always constricted. Okay. Even without an attack, it will be like this, like the middle picture. And during asthma attack, it will be more constricted. So basically, if you see a person with asthmatic history will always have very less exchange of air. Okay, it's normally their airways are constricted, but imagine even that less lumen becomes even lesser during asthma attack. So how difficult they find it to breathe, that only they can understand, who have this condition going on. So here is another picture. So if you see, this is our, the green circle is our outer covering. Okay. Now the inner one where there is this thing, drawn, that is other connective tissues and cartilages, etc. Now this pink one, dark pink one, is the smooth muscle that is covering the airways. And this light pink is the mucosa. Okay, now we know our airways are moist. Our airway is moist because there is a slight secretion of mucus through these blue. Blue, if you see this, these are the glands that secrete mucus. Now, why mucus is important? Now, what happens when you have dust particles going in? Sometimes you cough it out, or even during when you have cold cough, you cough out. Where does the mucus come from? It comes from these small glands. See here, they secrete. Now, what happens during asthma attack? Your this dark pink layer, which is the smooth muscle, it inflames. Okay, there is an inflammation there. Now, what happens then when it inflames? It makes this lumen, the black hole here, makes it more smaller. And then these mucosa layer starts producing more mucus, and it starts filling the lumen. So what happens? There is hardly any space. See, it's all clogged with mucus. Where is the space for the air to flow in? So this is what happens during asthma. Now, asthma is nothing but it's a natural reaction of our own immune system towards allergen. So, what happens is we have certain cells called mast cells in our blood. Okay, and inside the mast cells we have histamines. So, histamines are the ones which get triggered when there is an allergen. So, I don't want to get deeper into the immunology of it. Just a gist of it. So what happens when an allergen enters our body? There are antibodies created. We already have fewer antibodies. If it is a known allergen, we have several antibodies against that allergen. So antigen antibody reaction takes place. What it does, it goes and sits on the mast cell. Okay, mast cell is the one, a very very important cell in our immune response. Inside the mast cells, there are histamines. So when antigen antibody come and sit on the mast cell, what happens? The histamines get released into the bloodstream, and this reaction gets too much haywire, too much overboard, that people suffer from attacks like asthma. So it is basically our immune response against allergen which ultimately leads us to all these discomfort. It's really an irony, but that's the fact. Now, that was little bit about the pathophysiology, what exactly happens during asthma. Now, how do we manage asthma? So there are bronchodilators. So usually when we go to doctor, they give us bronchodilator. They relax the inflammation in the previous inflammation that I showed you, that pink one. They relax those muscles. So there is it becomes slightly normal, and then the person is able to breathe properly. Then anti-inflammatory, it's similar, they give anti-inflammatory medicines are there. Then if nothing works out, the ultimate treatment, that is for people who have like extremely severe ones, biologic therapies are there. So nowadays, like, all these monoclonal antibody treatments have become very normal for a lot of medical conditions, including asthma. So there are some monoclonal antibody treatments that the doctor can suggest as a part of the treatment. Now, there are some red alerts when you should visit a doctor. So, as I said, the signs and symptoms are like cough, there'll be cough, breathlessness, wheezing, chest tight. It can be very mild to moderate. If it becomes very severe, that you're not able to breathe properly, you're not able to sit, you're not able to sleep, then that is a red zone. That is when you need to contact the doctor. And even, there are two types of inhalers basically. One is the blue one. Blue is the rescue one. Like if you have an attack, so you just, take two, three, or even sometimes they say 10 based upon your what the physician says. You can, in one attack's time, you can take even 10 puffs at a particular gap, You just have to go by the doctor. I'm just telling you one information. You should not, do it yourself without doctor's consultation. There are blue inhalers. There is one red inhaler, which is the steroidal one. So that is like a long term one. So they'll say take twice or take once. There'll be microgram of with each puff, certain microgram of medicine, gets in and it gives you a relief. So there is rescue therapy. There is a long term therapy. Now, the other red alert is like, peak flow. So what is peak flow? So it's a machine. It's a handheld machine actually. So you just have to put it in your mouth and you have to expel air, carbon dioxide. So based upon the expiration, there are certain categories. So that is divided to green, yellow, and red zone. So green is like if you're able to expel 80 to 100 percentage, then it is good control. If you're able to expel 50 to 80 percentage, then that is like, you're in an not really great need for a medicine, but you have to be alert. Now, red zone is less than 50 percentage. So that is the medical alert. So you need to keep a watch on these. Always have your puffs with you, puff that inhalers with you. That is very important. So sometimes when you go for physical activity, rigorous physical activity, what happens suddenly the attack might. So you should have that inhaler with you handy all the time. Next is there are certain questions like, will it go away on its own, or is there any treatment or cure for asthma? So what they say is asthma is a lifelong condition. People can be symptom free for a longer duration of time with proper control, but a trigger can cause again asthma attack once again. Then it can improve and disappear completely as you get older. So smaller children, if they have had asthma in the childhood, as they become adult or teenagers, then there is a change in your physiology, and then certain things are there which can it can just go away, but later on in life it can appear as well. So there is no guarantee that once it goes, it will not come back. So that is the one thing about asthma. So they say there is no cure for asthma, but we can prevent it. We can prevent with our lifestyle changes by knowing what to eat, what not to eat. So there are so many other things that are included where we can be little bit more precautious and try to avoid the attack. So, what are the lifestyle changes that can be done? So, first is introduce yourself to yoga. Then, if you're a smoker, you need to stop smoking. If you go to doctor and a smoker, then doctor will definitely tell you to stop. Now, if you get an asthma attack due to strong smell of perfume, then you have to keep those things out. Shampoo, lotion, anything that is smelling, you smell and you will know. You know it that it is going to cause me an attack. So just avoid those. Animal fur, a lot of people are animal lovers. They like to keep the animals inside the house. They let animals on the sofa, bed, everywhere. But if there is an allergic reaction because of the animal fur, it is better to avoid such things. Then in the house, if there are rugs and carpets, you need to dust them regularly because what happens in rainy season sometimes they can become moldy. Even if there is no sunlight, proper sunlight's coming inside the house, mold is a very common issue in such places. So it's better to keep go on cleaning, dusting the house. Then do not let animals into the bed or bedroom. Inside the bedroom, what all changes should be done. So no, again, no smoking, no strong smell in the bedroom. Always does the mattress, blanket, pillows, and all those things. You have to keep everything very clean. Everything should be dust proof. You can keep, nowadays we get a lot of mattress covers, pillow covers that are dust free, dust proof. So you can use those kind of thing. You get several things in the market these days. Then you can even have an air purifier at home. So, air purifier takes care of most of the dust in the house. And keep the windows and doors open if it is really stuffy. When you're cooking, keep the chimney on. The tadka that we put for our curries and all can cause cough, and then later on lead to attacks of asthma. So if there is a lot of pollution, then you need to keep the windows and doors closed. Try to be as much free from pollution as possible. These are just see these are a few points that you will see when you go to doctor. With the complaint of asthma, they will usually there is a guideline. It's called GINA guideline. So Global Initiative for Asthma. There's so many points. I've just taken few points from there. So if you read, you can go to Google and find out GINA guideline for asthma for patient. Okay, so just read it through. It is like it tells you exactly each and every point what you need to take care about. Okay, now coming to dietary management. Now food, what we eat is what we are. So we need to be very, very careful in choosing our food because as I said, whatever we eat, that is what makes our mind either peaceful or very agitated. And in asthma, no, people should try to be more calm. They shouldn't be very hyperactive or do anything that can trigger their condition. So I'm not going into too much detail. Basically, we'll talk about these kind of foods like sattvic, rajasic, and tamasic. Sattvic food is basically fresh fruits, vegetables, whole food, anything that is fresh, juicy, a lot of ghee, all that is sattvic food. Rajasic is too bitter, too sour, too salty, pungent, hot, and dry. So that kind of food you should try and avoid. Tamasic food is any food that is stale, reheated, so they say within 3 hours we should, eat the food, which is very difficult nowadays considering our lifestyle, the time and all we have. But try to consume that day's food that day itself instead of keeping it for next day and reheating and eating it. Now, the sattvic diet that we talk about, it has got a lot of dietary fiber. So when we are eating fruits and vegetables as part of sattvic diet, it's got dietary fiber, which is very good for our gut health as well. Fatty acids, so they say omega-3 fatty acids and omega-6 fatty acid rich foods are very good and they reduce inflammatory activity. Uh, Also antioxidants like vitamin A, E, C. We should eat lot. Find out in Google. We get so many information. for which foods are good and rich in antioxidants, selenium, zinc. So please go and research, consult a dietitian, they nutritionist. They will help you find out, figure out what are the good sources of vitamin A, E, and C, which are rich in antioxidants, vitamin C also. Then coming to milk and milk products. So again, milk has a lot of protein. Casein is a protein. Then lactalbumin is there. Minerals like calcium is there. So consumption of milk is also very good. Now we'll come to the main point, that is our yogic management. So we will be in coming 5 days. We'll be doing a lot of asanas. We'll also try and do certain shat kriyas. I will try to demonstrate one of the shat kriyas. You should not try it out on your own. It should be done under an expert's thing. And because 5 days we're not going to do the same Shatkriya, we'll be doing different and try to understand various Shatkriyas that can help you in case of asthma. So I will try to demonstrate one of it, but I request not to try it on your own unless you are expert. So we just try that. Surya Namaskar is one of the very good yogic practices that can help us, get rid of, avoid, in fact, these attacks. Then we'll be doing certain sukshma vyayam, yogasanas, pranayam, yoga, and special practices and meditations, etc. throughout these 5 years. 5 days. So Shatkriya, what are the benefits of Shatkriya? Shatkriyas are nothing but cleansing techniques. There are 6 cleansing techniques, but I'll just demonstrate one of it in one of the classes in the upcoming days. So what Shatkriya does, it balances tridoshas, Vata, Kapha and Pitta. So these are the major causes of all the illnesses in the body. So if it is not balanced in our body, then we will have some of the other physical ailments. Now, as I said, neti, jal neti, what it does is it desensitizes the nostril. So basically, we put water, saline water from one nose and take it out through the other. So what happens? It sensitizes the nostril and prevents asthma trigger. Then Shatkriyas keep respiratory system very strong, so we can handle the attack pretty well. Regenerates the entire body, keeps us healthy, strong. 20 types of cough diseases, all vata diseases, pitta diseases. So many ailments gets completely cured with regular practice of Shatkriya. So Surya Namaskar, I need not say, Sukshma Vyayam. It's very like we'll be there doing subtle movements of our body parts, joints. So what happens? They become little, how we put oil for oiling the, if any part is not working properly, we put oil. So that is like an oiling to our small joints and all that. So it'll improve circulation, and it can be performed by people of any age. It's just a warm up exercise to prepare our body for the asana practices. Then Surya Namaskar. So there are so many benefits of Surya Namaskar. So if you see physiological benefits, it prepares the body for asana practice. It stimulates all our 9 systems, balances all the 9 systems we have. Immune system is strengthened, muscle strength, improves. Then if anybody has menstrual cycle issue, it regulates it, helps in losing the body, toning the body basically, improves the lung capacity. So various poses that we do in Surya Namaskar helps in lung capacity. Uh, who all should avoid if you have all these conditions, BP, high BP, heart issues, stroke, hernia, should try and avoid, doing vigorous Surya Namaskar. So these some of the asanas that we will be doing, and some of the sukshma vyayams that we'll be doing. Some pictures I have put there. Uh, what are the benefits of asanas? Improves breathing, improves posture, calms the mind. It helps reduce the stress. any respiratory and cardiac function issues we have, it improves. So all these are the benefits of yogasanas. So these are some pictures, but it is not limited to these. We'll be doing so many asanas every day. We will try to do new asanas and try to do variations of various asanas. So attending all 5 days is very important to see. Later on, if you learn these asanas properly, then you can do slowly. Inculcate in your daily routine as well. So. Next is about pranayam practices that we'll be doing. So, what is prana? Prana is basically nothing but the life source. What is ayam? Ayam means it's a voluntary effort to control and direct the prana, that is the our breath. Okay. Now, breathing is the only vital activity that can be regulated voluntarily. There is nothing else. We cannot control our blood circulation or heart beats. The only thing that we can control is breathing. So it connects with both nervous system and the mind. Nervous system is very important, to keep our mind in control. So I'm not getting too much into technicalities of these now. Now, uh, what happens? So uh, pranayam is basically, it's a door point. It's a door between physical and spiritual path. So it's usually done in a seated, relaxed posture, and each cycle of pranayam involves Purak, Rechak, and Kumbhak. So this technique I will be teaching you during our tomorrow's class. What is Purak? What is Kumbhak? What is Rechak? And so if you notice, it's said that when we are stressed out, what happens? Our breathing pattern changes. When we are sad, when we are angry, every time it directly affects our breathing. So we have to control our, we have to have control on our breathing, and that way we can, control our emotions as well. It's written like mainly controls the mind, right? And when mind is still, no thoughts or emotion can disturb us. And by practicing pranayam, the ability to perceive reality intensifies. The mind is trained and capable of process of dharana. All these are higher practices. After pranayam, there are certain practices that pranayam can help us lead to those practices. Nadis are purified. There is Nadi Shodhan Pranayam, which we'll be practicing during one of the classes. And cleaning the nadis, pranayam eradicates all types of toxins that are there in our body and in mind. So when the breath is slow and deeper and rhythmic, brings about lot of relaxation to our mind. So when we do these practices, you can actually feel it. Even if I say it, you may not be able to understand. But if we actually practice it in practical, then we can definitely feel that relaxation. Now, ego is controlled. There is a lot of behavioral changes that you would see if you continuously are doing or a practitioner of pranayama. Then next is about coming to Om chanting. We'll be doing a lot of meditative practices during these 5 days. So there are a lot of physical, mental, and other benefits associated with with the Omkar chanting. So it reduces the stress, our mood is improved, focus is better, anxiety and depressions are reduced. Physical health, in the physical level, it can help us reduce blood pressure, gives us better sleep. If we are in pain, it helps reduce pain, it improves our immune system. Then the other benefits you would say is like self-awareness, improves creativity, patience, memory, willpower, introspective awareness, then self-directedness, cooperativeness. All these are the other benefits that we get. We'll also be doing Yoga Nidra. It's a longer practice, but we will try and do it at least once so that you are aware and you get the experience of this practice, which is extremely relaxing. It's physically for physical health, it is very good. Stress is reduced. there's improvement in our mood, improvement in our sleep, concentration, self-esteem as well. Okay, so day wise there are certain uh, you know things that we will be doing. Now, I the presentation is over, but there are few things that I'd like to tell you all. Yes. So, tomorrow onwards, because we will be beginning our yoga practices, please ensure that you have had food at least 2 hours prior to the practice, and you have not, and mala shuddhi, you should have passed your motion. Your stomach should be empty. That is 2 hours after food. Um, wear comfortable clothes when you are coming for practice, that you are feeling comfortable. You should have a yoga mat on which, or if you don't have a yoga mat, at least have something. Do not do it on the floor. And during the practice, if there is any difficulty that you're not able to do certain poses or something, don't feel disheartened. With practice, it will come. So that is why we will have like 5 days. We'll be doing these Sukshma Vyayams that will help you build little more flexibility and prepare your body for asana. The other important thing is, after the practice is done, you need to give yourself at least 15 to 30 minutes break before you take a shower or before you eat anything. So these are the few precautions that I would like you all to follow. So morning when you are joining, empty stomach, clear motion. So that is one important aspect. So if there is any questions, I can take it. Now we have 2 minutes. If I'm able to answer, I will answer it today. Or if I have to refer to some literature, I will refer it and get back to you in tomorrow probably. I hope everybody is awake because all the cameras are off. It'll be nice if you can just show your face so that tomorrow, you are not strange to me. And okay, Saili ji, thank you. Basanti ji, thank you. Sapna ji, thank you. Shubha ji, Sulakshna ji, somebody's joined as iPhone, MS, Smita ji. It would be great to meet you today so that we have a very comfortable next 4 days. Okay, no problem.
थैंक यू मैम, बहुत अच्छा था। मैं
Thank
भी
you.
बेंगलोर से ही हूँ।
आप
एक्चुअली
कहाँ
मैं
पे हैं?
बंगाली हूँ। मैं बंगाली हूँ, लेकिन मैं बेंगलोर में रहती हूँ।
अच्छा, ओ वेरी नाइस।
आप कहाँ रहते हो? मैं संजय नगर में रहती हूँ।
कहाँ पे?
संजय नगर।
संजय नगर.
यस।
Ah, okay. I know Sanjay Nagar. It's near Tavarekare, that area, right? No.
Hebbal is straight, left side is
Okay.
left, Sanjay Nagar.
Okay,
This is
Sanjay.
Matic Circle. Matic Circle is round. After that, left side is there. Straight is Hebbal.
Okay, I live in Electronic City.
Oh, Tumba Dura. Tumba Dura.
That's like the other end, I
Yeah,
know.
yeah, yeah, yeah.
Yeah,
From here is 2.5 hours journey because there's traffic.
yeah.
Yeah.
Correct. In Bangalore, we talk about hours, not kilometers.
Yes, yes, yes. Correct.
Okay, nice.
Mm.
So, I think we are finishing right on time, Renuji.
A very
Yes.
nice session, Seema ji, and very nice. And I hope you all also have got some, valuable insights regarding asthma, very different topic.
Yeah,
So
it
see,
was very beautiful session, Seemaji.
Thank
yes.
you.
Nice, nice.
Thank you, Lakshmi. Thank you so much.
So please, all of you, come prepared as what Seemaji mentioned. Follow the guidelines and see you on mat tomorrow. And don't forget to put your feedback. I have shared the link in the chat box. Please share your feedback. Thank you.
Thank you so
So
much.
Hope to see you all again tomorrow and next until Friday to have a very fruitful session with you all. And feedback would be really, encourage us and to improve us, how we can, do further. Yes, Sairi, do you have any questions?
नो मैम, क्वेश्चन तो नहीं है, बट थोड़ा बहुत हिंदी में हो सकता है।
अरे पक्का आप
बाकी
बता
सेशन
देते,
समझ में
मैं पूछना भी भूल गई। ठीक है, मैं
नहीं,
कल से।
नहीं मैंने चैट बॉक्स में टाइप किया था, पर शायद वो पहुंचा
वो
नहीं
मुझे
कुछ,
दिखा
क्या
नहीं,
पता।
सो सॉरी, सो सॉरी। अच्छा, ठीक है, आपको लेकिन कुछ कुछ समझ में आया पिक्चर देख
हाँ
के?
हाँ हाँ, समझ में तो आया, पर हाँ हाँ, समझ में तो आया, पर वो पूरा फटाफट 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 हो जाता है ना,
हाँ,
तो
करेक्ट
थोड़ी सी
करेक्ट।
मुश्किल हो
ठीक है,
जाती है।
आपको अगर कोई डाउट रहेगा ना तो आप मुझे पूछ लेना। ठीक है, तो अभी कल के लिए तो आपको 2 आवर फास्टिंग करना है, तो 11 बजे
हाँ
है
हाँ
तो
हाँ, वो नहीं, मैं
वो
वही
सब
बोलूँ ना कि वो समझा मुझे, पर वो बाकी सब फटाफट फटाफट हो जाता है
टेक्निकल,
ना।
हाँ।
और सब वो मेडिकल मेडिकल वो वर्ड्स है ना, वो सब ब्रोंकाइटिस, वो सब सब
हाँ,
कुछ
वो तो कैसे हिंदी में बोलते हैं मुझे भी
इसीलिए।
पता नहीं है।
नहीं नहीं,
उनको।
वो सब ठीक है, नहीं नहीं, वो सब ठीक है, पर थोड़ा बहुत हो जाता तो भी कैसे।
अरे मैंने सो सॉरी, मैंने ना, मैं चैट बॉक्स आया ही नहीं
नो
क्योंकि पूरा
मैम,
स्क्रीन
आप
में
क्यों
यही
सॉरी
था।
बोल रहे हो, आप मुझे से बोल रहे हो।
हाँ।
नो प्रॉब्लम। नहीं
ओके।
ठीक है फिर मैम, अभी भी 4 दिन है।
हाँ, जो डाउट है प्लीज आप पूछ लीजिएगा, फिर हम क्लैरिफाई कर लेंगे। रेस्ट एनीबडी
थैंक यू
एल्स
मैम,
हैज
थैंक यू
किसी
सो
और
मच।
को इशू हुआ तो प्लीज बताइएगा। कमिंग डेज में कोई भी डाउट रहेगा हम क्लियर कर लेंगे। ठीक है।
नाइस सेशन सीमा जी।
थैंक यू।
बहुत अच्छा था सीमा जी।
थैंक यू सुनीता जी, थैंक यू सो मच। ठीक है, आप लोग फटाफट फीडबैक भी दे दीजिए, ताकि आज नहीं तो कल भी दे सकते हैं, तो दे देंगे तो हम अकॉर्डिंगली इम्प्रूव करेंगे। थैंक यू सो मच। ठीक है, तो सेशन एंड करने से पहले एक छोटा सा प्रेयर कर लेते हैं। सिट स्ट्रेट। टेक अ डीप ब्रेथ। श्री ओमकार चैंटिंग। इनहेल। ओम। इनहेल। ओम। Inhale. सतो मा सद्गमय तमसो मा ज्योतिर्गमय मृत्योर्मा अमृतं गमय। ॐ शान्तिः शान्तिः शान्तिः। O God, lead us from untruth to truth, from darkness to light, from mortality to immortality. Om, peace, peace, peace. Rub your palm, cup your eyes, remove your hands, and gently open. Thank you, everybody.
Thank
So
you.
I'll see you all tomorrow. Bye bye. Thank you.
Thank you.
Bye. Bye.
Thank
Bye.
you.
Avinash 4, Chummu 5.